But first, our top story. Russia is first off the blocks in clearing a vaccine against COVID. It's called Sputnik, and the Russian President Vladimir Putin says it's safe. He has even inoculated his daughter. He insists that it works. Some say more tests were needed before releasing it. Let's just bring you a couple of more points, a couple of graphics points, so that we know exactly what it is that we are talking about. So Russia claims to have developed the vaccine which offers sustainable immunity against the COVID-19 vaccine. Russian officials say that industrial production is expected from the month of September onwards. There is a considerable interest in the Russian vaccine, is what the government of Russia has to say. Preliminary applications for over 1 billion doses have been received from 20 countries. But the big question that really is being asked is whether it's safe before more trials are conducted. Joining us now to look at this, Dr. Peter Chin-Hong. He's an infectious disease specialist at the University of California in San Francisco. Also joined by Evgeny Bezega, the press secretary of the Embassy of Russia in India, and Dr. Sunila Garg, the director and professor and head of medicine at Maulana Azad Medical College and an advisor to the Indian Council of Medical Research. Mr. Bezega, let me come to you first. Why does Russia believe that this is absolutely safe when stage 3 trials, which involve many more people, hasn't been done as yet?
Good evening, Mr. Vishnu. Well, already the two trials, there has been already trials conducted. They began in June, and by August 1, the first 2 phases of these trials were completed. These trials have proven that it is a safe vaccine, and therefore the registration certificate was issued by the Russian Ministry of Health. It was announced today at the meeting of members of cabinet with President Putin. At the same time, the trials will continue, and it is yet to just to make sure that this vaccine will be absolutely safe for everybody. Mm-hmm. And phase 3 clinical trials will involve several thousand people, and it will begin in several countries from tomorrow, from August 12th.
Okay. Dr. Peter Chin-Hong.
Only after that, the production will begin.
Start.
The
All
production
right.
will start in September.
Sure. Dr. Peter Chin-Hong, do you have any concerns about the speed at which this is done, or the transparency in which these tests, the preliminary tests done in Russia, they believe these tests are comprehensive, have been carried out?
Thanks for having me on, Vishnu. Yes, I think in the United States we have, and I think for many people around the world, we do have questions about transparency. I think for all the other studies we've seen, Oxford, some in the US, even in China, we've seen some of the early data. We're also worried about the fact that, from reports, it seemed that the testing went from the lab straight to people without going through the regular phase 1, phase 2, and then, now hearing details about phase 3, I think that's, some more information that we wanted.
Okay. Mr. Bezeka, has India evinced an interest in this as well?
Yes, there were several countries expressed an interest. There is a Russian direct investment fund which is responsible for promotion of the vaccine abroad, and the head of this body has announced that among the countries which expressed its interest in vaccine is India.
All right. And Dr. Peter Chin-Hong, the fact is that 20 countries have, at least 20 countries have evinced an interest. The Russian president says he's inoculated his own daughter. I mean, so is this not something that we should take very seriously as a serious claim? Russian medicine has been very advanced in the past, and if they're making this claim and they say that it's proven, why would they necessarily be wrong about it?
Yes, just again, Vishnu, it comes down to the very basics of science, which is transparency. There are 3 T's in vaccine development, I think. One is testing, of course. So you want to have phase 1, phase 2, phase 3. The second T is transparency, and the third 3 ultimately is trust.
All right. And you feel that trust is missing, right?
I do feel the trust is missing because as a scientist, I want to see the data. I don't care who makes the vaccine. I just want to look at the data and then interpret it on my own.
That's a fair point. Mr. Bezeka, do you believe, as in the case of the Oxford vaccine, which was peer-reviewed, and the Wuhan vaccine, which was peer-reviewed, there needs to be a public release of data so that scientists around the world can learn more about the Russian vaccine?
First of all, I would like to state that since this vaccine involves the health of people and security of so many people, it has to be done in a most transparent way. And the government of Russia is making everything to ensure that this information is shared. A special portal has been launched dedicated to this vaccine, where anybody can find all the certificates and scientific papers relating to the trials and everything what is required about this vaccine. So this is the most important thing, and I think, well, anybody can just open that website and see it.
Mr. Bezeka, the other key question over here is cost. How much will this cost, and who's going to get it first?
Well, it will take some time before the mass production will begin. At this stage, there are only two facilities which are capable of producing this vaccine. It's the Gamaleya Center itself, which has developed the vaccine, and a company named Binopharm is another company. So Russian Direct Investment Fund, which is a state wealth fund, will be financing it, and will be also getting in touch and striking partnership with foreign countries.
Sure.
So first people to get this vaccination will be those who are dealing with the children mainly and with ill people. So it will be doctors and teachers.
Okay. Dr. Sunila Garg joins us as well. Dr. Garg, I think everybody wants a vaccine as soon as possible, but people want a safe vaccine. Of the little that we do know about the Russian vaccine, it appears that that individuals get a certain temperature and then apparently develop antibodies. Is that safe enough? Is there an expectation that when you are inoculated, in the best case scenarios, irrespective of the vaccine, that people would initially develop a temperature before it goes away and antibodies are formed?
Yeah, definitely. You see, what I like to say is that since the vaccine has been introduced, vaccine has already passed, phase 1 trial and phase 2, but, we have gone to the direct, giving it to the masses without even testing for phase 3. But you see, the persons who were injected, and first of all was also the president's daughter, she also developed little fever. I think developing fever is not one of the major criteria. We are looking at ultimately major side effects also from the vaccine. So that is one of the important concerns which we look at from the public health perspective. So here you see, before the vaccine is launched for the public use, we need to look at the safety concerns of the vaccine, and we need to look at exactly any of the, not only the safety concerns, but it is useful for the larger number of people. So that is one of the important concerns which we have, and India's government has already formed a task force which is going to look at both from the safety perspective also, and we will also be looking at on the priority basis to whom this vaccine has got to be given. Has already been mentioned that healthcare workers will form a major group, the elderlies will form a major group, and also in Russia they have commented that the teachers will be another group who will be forming for a major group for consumption of this vaccine.
Okay. Dr. Chinong, final question to you. There are now so many vaccine candidates around the world. I understand that you've got your reservations because you would like to see a lot more before making up your mind on the Russian vaccine. But in your mind, which vaccines candidates are showing the maximum promise at this stage? It's been a few weeks since we've seen the Oxford, the report on the Oxford vaccine candidate, the Wuhan vaccine candidate. There's been talk of a few more. In the last few weeks, what are some of the trends or some of the expectations that you can share with us?
Thanks for that question, Vishnu. I'd say the major trend is speed. I think many people didn't expect the vaccine to be produced this fast. I mean, most were thinking 12 to 28 months at least. So it's really speed that's really the primary thing. I think the Oxford vaccine, the Wuhan vaccine, some of the work done in India and in Boston, the Moderna vaccine, those are the ones we've seen data from, and I think they seem very promising. I know Oxford and Moderna are in phase 3 right now, and we look forward to seeing what those tens of thousands of people's antibody responses look like, as well as safety profile.
All right. Well, I'd like to thank all of you very much for joining us. These are exciting, these developments. I think the issue of safety would be foremost on everybody's mind, and hopefully the Russian vaccine will prove to be safe and, who knows, perhaps get to us as soon as possible. But that, of course, remains based on so many different factors. I'd like to thank all of you very much for joining us.